So, good afternoon, everyone. I'm Alan Barrett, Director of the ESRI, and it's a great pleasure to welcome everybody to this afternoon's seminar, where we're launching a new report, The Response of Low-Income Households to the Cost of Living Crisis in Ireland. So in a couple of moments, I'll be inviting ESRI colleagues to come and present the details of the report. You'll have read about some of this in the papers already today, and also some coverage on the radio. But nevertheless, again, my colleague Timur O'Callagh will be taking you to the reports and the findings in a reasonable amount of detail. After that, immediately after the presentation, we'll have a little bit of time for Q&A. So if people want to ask questions of the report authors, they should start submitting questions to the Q&A function at the bottom of your screen, and I'll try and relay those questions. After that, then we'll broaden the discussion a little bit. I'll introduce the folks at the time, but we have three interesting panelists who will give their reflections on the report. And after that, then hoping we'll have a little bit of time left at the end that we can take some more comments through the Q&A function and keep the conversation going. So we'll achieve all of that in the next hour and a half or so, and hopefully it'll be a good and lively session, which I'm sure it will be. Now, but before all that, it's a real pleasure for me to introduce Mark Hussey and introduce him to you all on the webinar. Mark is with JP Morgan Chase, and somewhat unusually, most ESRI research is generally funded by public sector agencies, but on occasions we get approached by people from the private sector who are interested in sponsoring work in particular areas. And delighted to say JP Morgan Chase approached us some time ago, and we agreed to undertake this piece of work with their backing and funding. So it's been a very, very positive experience. We've really appreciated their engagement. Always important to say ESRI is an independent organisation, so we also appreciated the fact that JP Morgan Chase very much appreciated our independence and let us produce the report in the way we wanted and let the data say whatever. But with that, Mark, I'd like to invite you onto the screen, and do you want to take a few moments to talk about the report?
That's great. Thank you for the introduction, Professor Barrett. And good afternoon, everybody. I'm, as Professor Barrett said, I'm Mark Hussey. I'm the Senior Country Officer for JP Morgan Chase here in Ireland. As a firm, actually, we can trace our roots in Ireland all the way back to 1919. But if you fast forward to today, we're now one of the country's largest providers of wholesale payment solutions, a significant custody and fund service administrator here in Ireland. And we also have our employee share plan service for our clients globally here in Ireland. Today, we employ around 1,500 colleagues across Dublin, Cork City, and Clonakilty. So as the professor said, as a global financial institution, we believe that business has a key role to play in tackling pressing societal issues, and we look to bring the capabilities of our firm to bear and to help address some of those challenges. Indeed, I would say that at JP Morgan, we believe that we will only succeed as a firm in terms of our core business mandate if the communities and societies in which we operate also are successful. So across the various markets, including Ireland, where we do business, we do work to support careers and skills, business growth and entrepreneurship, as well as financial health. And the work today that we are going to hear about from the ESRI sits very much within our financial health pillar. And we hope it'll set the foundation for strong and resilient households and communities in Ireland. Indeed, I would say that the insights that are revealed by the research being launched today are actually applicable to the wider work which we are doing, both here and indeed internationally, to help create stronger and more inclusive economies. So, for example, the bulk of our philanthropic efforts in Ireland are focused on delivering tech skills training for disadvantaged young people with a view to helping them access better employment and career paths in the tech sector. And I think one of the most important takeaways that you'll hear from this report is that deprivation is a stronger indicator of vulnerability than often income is. And I think for us, that means as a local employer, we want to better leverage deprivation data in order to better target those most in need of our support. And I think that's why it's great to be here today to mark the launch of this report and to hear insights from key stakeholders on exactly how we can make contributions to initiatives that will make a difference to those that are most disadvantaged in our communities. I also want to say on behalf of JP Morgan Chase that thank you very much for the team, to the team at ESRI for all of their work in preparing this report. You've been a fantastic partner over the last 18 months, and it's great to have such impartial, interested, and dedicated people here today to help analyze and discuss the report. So I'm very much, along with my colleagues, looking forward to the discussion and seeing how the findings from this report get carried forward. And then lastly, I would just close by saying that if you have any questions about our wider philanthropic work in Ireland, then my colleagues Luke Onsworth and Madeleine Berry are both on the line today, and obviously we'll be happy to follow up with you separately. So with that, I'll hand over to the team who's actually done the work, who are behind this report at ESRI, to tell us about it in more detail. Thank you.
Great. Thanks so much, Mark. Appreciate those. I won't take time now, but I'd love to hear the story about the origins of JP Morgan Chase in Ireland. That sounds fascinating. You're just on mute, actually. But
just, all the way to Michael Collins. We'll have a cup of coffee and I'll tell you all about it.
Very good. Looking forward to hearing it. Thanks for that. So Dermot, if you want to take the screen now, I should say Dermot is one of the authors, and always want to give due credit to the co-authors Lucy Martin, Shane Timmins, Deirdre Robinson, and Pete Lunn. But Dermot, you can take all the credit from here and run through the presentation. So I presume you got a few slides you're going to share.
I do indeed. Yeah.
Yeah, they're coming up now.
Okay, yeah, so I'm just going to give you a brief overview of the report in terms of what we did, number one, what we found, and the implications that arise from that. So what we were interested in with this report was how low-income households in Ireland had responded to the cost of living crisis, which, as you can see from this graph of the inflation rate in Ireland over the past few years, really was at its height in the 2 years 2022 and 2023, which is the 2-year period that we'll focus on, and I'll go into more detail about that, right? So we had two main aims in our study. The first was to look, as I said, at how low-income households responded to the crisis. And the second was to look at how they used government benefits and support services during the crisis. So we did this using a survey. So we recruited a nationally representative sample of just over 1,600 people from low-income households. Now, by low-income households, I mean those below around 85% of median equivalized income. So equivalized income being income adjusted for household size, essentially. And of that 1,615 participants, we recruited most of them online, and then we recruited 100 in person to get at some hard-to-reach demographics. And we ran the survey in May and June of last year. So the main questions we asked participants in the survey were, one, what changes had they made since the start of 2022? So they were completing the survey in the first half of 2024. So we're asking them essentially over the years 2022, 2023, and maybe the first bit of 2024, what changes had they made to things like day-to-day spending? Were they borrowing more? Had they used up savings in order to cope with the price increases that came in that period? Now, of course, remembering back over what you've done over a 2-year period can be tricky from a memory point of view, right? So we used established techniques from behavioural science to help participants remember that period better so that they could give more accurate answers to our surveys. So the first thing we did was we used the Russian invasion of Ukraine, which really kicked off the worst of the cost of living crisis at the beginning of 2022, as a starting point that participants could use to to help with their memory. And secondly, then we also asked them to recall major life events that had occurred for them in that period, which is a method which can help people remember a period by helping them to sort of reconstruct that period in their minds. Now, the second major batch of questions we put to participants was what government benefits and support services they had used, and what were their experiences of those supports, right? So in terms of experiences, we particularly focused in on what are called administrative burdens. So these are kind of the difficulties that arise for households, individuals, when they're trying to access supports, be they government benefits or support services such as charities, etc. Now, one more important point I'll mention before I get into the results is that we categorized our participants according to standard classifications that are used by the Central Statistics Office here in Ireland. So the first was regarding income, right? So we classified as those with very low income any household who was below 60% of median income, right? So that comprised about a third of our sample. Now, this is the equivalent of the at risk of poverty categorization used by the CSO. We just decided to call it very low income in our report just for it made our report easier to convey. And then anybody that was above that threshold, so between 60 and around 85% of median income, we called them somewhat low income. The second classification then was according to deprivation. So we used the measure again used by the CSO, which categorizes people as deprived if they satisfy two indicators of deprivation. So essentially being unable to afford some basic necessities, things like keeping your home warm enough, replacing worn out clothes. And just under half of our sample were classified as being in deprivation. So that then gave us four categories into which we could classify participants based on the combination of their income and their deprivation. So now I'm going to take you through some of the main results in terms of how households responded. How do they respond to the cost of living crisis in order to cope? So first, we look at cuts to day-to-day spending, and I'm showing you here the top 5 categories of day-to-day spending in which households made cuts. And so we see that the top category was groceries. So of the full sample, so that's the blue bar here, 63% of households made cuts to their grocery spending, 60% clothing and footwear, 53% electricity and heat. And what's interesting to note here is that most households made cuts to basic necessities as a result of the cost of living crisis, irrespective of their income or their deprivation within our low income sample, right? So I think it was just over 9 in 10 households within our full sample made some cuts to day-to-day spending, and in many cases to day-to-day necessities such as electricity and heat, such as groceries. A second very important point to note here from this graph is that you'll see that those in the deprivation categories are much more likely to have made cuts than those not in the deprivation categories. So you can see here the deprivation categories, this yellow and green bar here, the not in deprivation categories, orange and purple. And what's particularly interesting here is that this is irrespective of income, right? So we're seeing here, this is those in deprivation in this yellow bar here, but who are in the higher income category in our low income sample. So they're on somewhat low income. They actually have much higher rates of making cuts than those who have lower income but are not deprived. So that's something we'll touch on again later, but just a point to note that deprivation, again, a much stronger indicator of having to make cuts due to day-to-day spending than income alone. We also looked at if households made changes to borrowing and saving. And what we see is actually, a good deal of our sample had made these kind of cuts. So we see a third of our overall sample had eaten into savings to cope with the cost of living crisis. We had 1 in 3 households either took on more debt or went into arrears on things like utility bills, rent payments, and so on. And we see here again that those in deprivation much more likely to have had to make these changes than those not, irrespective of income level. Now, we classify these particular changes as risky responses or risky changes because there's a potential there for long-term damaging effects to the household. So a household that has, for instance, taken on more debt risks financial insecurity in the future when they have to pay that debt off, or who've eaten into savings, for example. They no longer have that buffer to protect them from future economic shocks. So we paid particular attention to these kind of risky responses in our analysis. So we also, as well as the changes to borrowing and saving, we also classified cutting health spending and cutting back on education and training as other responses to the crisis that could have long-term negative consequences. And given the gravity of these kind of risky responses, it's not surprising that when we asked people to rate the stressfulness of various responses, that these were by far the most stressful responses for a household. They rated them highly in terms of stress. And what was perhaps surprising to us was the scale of or the prevalence of households that had to make these kind of cuts. So in our low-income sample, we found that over half of the sample had to make at least one of these risky responses, putting them in at risk of long-term negative consequences. And we found also that these cuts were more likely among households in deprivation and also households with children, who also found these responses more stressful than those outside of these particular groups. So again, households in deprivation seem to have been more impacted by the cost of living crisis than other households, along with households with children. Now, we wanted to look at what factors were linked to risky responses to see if we could get some kind of more insight into what was going on there, right? So we do find that those who make risky responses are more likely to have poor mental health, which again, given the gravity of the responses, the kind of stress incurred, that isn't surprising. Now, we don't find any evidence really to link risky responses to individual psychological characteristics. So, for example, financial education or the extent to which somebody prioritizes immediate outcomes over future outcomes. But what we do find is instead a link to situational factors, right? So circumstances in which an individual finds themselves in was a predictor of risky responses. So, for example, pre-existing financial stress or the extent to which they were exposed to price rises during the crisis. And this is in line with recent research on poverty alleviation and poverty research that finds that situational factors are likely to be much more important than focusing on individual level characteristics. So those are the main findings we had from, I guess, what you could call the first part of our survey on changes that households made to respond to the cost of living crisis. Now I'm going to take you through how those households used and experienced supports during the crisis. So first of all, we're going to look at what government benefits they used. So these are of the benefits we asked about. These are the most commonly used benefits. So state pension, child benefit up there. State pension is a percentage of individuals who are eligible for that child benefit, a percentage of households with children. So given these are universal benefits, unsurprisingly, quite high percentage of households there taking these benefits up. And then there's some other benefits that we asked about as well, with lower take-up rates, which a lot of them would be means tested. So that would partly explain why take-up is a little bit less. However, looking over at the overall picture and particularly specific benefits, we do see some evidence of a possible underutilization of many benefits, right? And a prime example of this would be the medical card, right? So here we see in our low-income sample, less than half, 42% of participants are using reported using either a medical card or a GP visit card. And actually, when we focus on our on the portion of our sample that are in the very low income category, who due to their low income are likely to be almost certain to be eligible for a medical card or a GP visit card at least, we find that just over half report using the medical card. And this is in line with previous research colleagues at the ESRI have done related to the medical card in particular. But this is just one example of how, in general, we find that for certain benefits, there's definitely evidence there of a possible underutilization. And I'll talk a little bit more about that in a slide or two. I want to move on first to talk about the support services that households used. So we asked about a number of support services, credit union, citizens information, St. Vincent de Paul, and so on. And this graph here shows the proportion of our sample that used each of these services. So I guess one overall stat to take in from our analysis of the support services use is that 1 in 3 used a support service of any kind, and of those, about a third were using that support service for the first time during the cost of living crisis. So that speaks to the large volumes of households which may have been doing okay before the crisis the cost of living crisis kicked in, but were thrust into financial difficulty and had to reach out to these services once prices started to rise. Second point to note here is we see a lot of variation in use of different services, and a lot of this is due to some services being more specialized than others in terms of the ranges of support they offer. And the final point, coming back to the deprivation, we see that those households in deprivation were much more likely, again, to use support services than those not. Now, I mentioned we see evidence for potential underutilization of government benefits in particular in our sample. And I guess that begs the question, what's the reason for this? Why aren't people using the available benefits, right? So when we ask people who weren't using a specific benefit why they didn't use it, 1 in 3 reported a reason other than a lack of eligibility, right? And that was mostly driven by a lack of awareness. So that points to a potential there for a potential information barrier there, being a barrier to people accessing benefits to which they're eligible. But we also asked those that were taking up certain benefits what administrative burdens they faced in accessing those benefits. And I'm going to take you through some of the results on administrative burdens now over the next slide or two, right? So first of all, just to explain how we measured it, we measured administrative burdens So essentially what we mean here is the complexity, the difficulties that people faced in trying to navigate the system and access benefits. And we measured it by measuring 3 distinct types of burden that people face. The first was learning costs. So essentially the effort, the costs that are incurred by a household in having to find out about a benefit when that's not 100% clear or 100% easily available information. The second related to compliance costs. So essentially this is the costs that arise from having to fill out all the paperwork, satisfy whatever prove that a household satisfies various eligibility criteria, attending appointments, and so on. And the final was psychological costs. So this relates to the frustration and the stigma felt, and even the loss of autonomy felt in the process of applying for certain benefits. So we each participant on each of these 3 aspects, they scored the benefits they were accessing on a 1 to 7 scale, and we aggregated these scores for each benefit to get an aggregate overall burden score for each benefit. And what we see, these are the top 10 or so benefits in terms of administrative burden overall. We see the additional needs payment is top there at 4.4 on a 1 to 7 scale. And I guess something that's worth noting here is that the benefits with the most burdens also tend to be those that are means tested and have the strictest eligibility criteria. Because if we look at the bottom of the table, so these are the 3 benefits down the bottom of the screen here that have the lowest level of average aggregate burden: child benefit, household benefits package, state pension. These are all benefits that are universal to the particular demographics to which they apply. And a final point I'll make in this is, and this is a very important point, is that where households were in deprivation, their average burden experienced in accessing benefits was higher than those not in deprivation. And also having very low income levels was also predictive of a higher burden score, which, given particularly with those in deprivation, given that we see that those were the households that had to make the most changes in response to the cost of living crisis, were most affected, and then they also experienced the most burden in trying to access benefits. So that pretty much sums up the main results from our study. Now I'm going to run you through some of the main policy implications that arise from those findings. So the first relates to the need to protect access to basic necessities during a crisis, right? So we saw that a lot of low-income households had to cut back on day-to-day necessities, had to take on debt, and they found these changes quite highly stressful. So this emphasizes the importance of, in a time of crisis, that interventions should focus on protecting households' access to basic necessities and also their financial security. The second policy implication that we draw relates to the legacy effects of the crisis, right? So I discussed earlier how many low-income households, and particularly those in deprivation and those with children, had to make changes during the crisis with potential long-term damaging effects. So things like taking on more debt and eating into savings. And what this implies is that in order to mitigate the worst effects of these changes, these households will need increased supports over the next decade or so, in order, as I say here, to minimize those scarring effects of the cost of living crisis. The third important policy implication we draw relates to the targeting of supports. And this is something that Mark touched on there a bit earlier. And essentially, so our finding that deprivation is a much stronger indicator of vulnerability during the crisis than income implies that targeting households for supports based on deprivation might be highly beneficial. Now, there's a caveat there in that this presents practical challenges, but we feel that more research here is needed and indeed is warranted into looking into how this could be actualized. We also draw some policy implications from our findings in relation to situational factors rather than individual psychological characteristics being linked to risky responses. And essentially what this says is that, interventions targeting individual level factors, things like financial education, might not be as effective in helping low-income households as interventions targeting more structural issues. So, for example, the administrative burdens that we find are inherent in the benefit access system. Next, an important implication also arises from our finding that several benefits were underutilized and that there's a potential there that this is due to informational barriers, right? So this points to the usefulness of some reasonably well-established techniques from the administrative burdens literature to tackle those kind of underutilization and due to informational barriers. So things like automatic enrollment in some benefits where that's possible, signposting supports to help people identify what benefits they're eligible for, and also implementing single point of application processes. So essentially allowing people to apply for several benefits at the same time using a single application process. Next, administrative burdens. So we found that many households experience burdens when accessing supports. And I guess the main implication here relates to what's called in the research behavioural audits, right? So we feel that there's a need there to look at certain benefits where there's particularly high levels of administrative burden and do what's called a behavioural audit. So systematically review the process for applying for that benefit to see where are the burdens arising. And by identifying exactly what step in the process these burdens arise, then you can act to try and minimize them. And a final more general point to conclude regards the future proofing of the welfare system, right? So we find that low-income households had difficulty accessing benefits during the crisis, and the worst affected in terms of burdens were those in deprivation who needed the help the most because they had been most affected by the crisis, right? So they faced a complex benefit system. So really what's needed is a simplified and resilient welfare system going forward, can help for future crises, to help mitigate the damage they do to households, the extent to which households have to make risky responses, and so on, but also can help households who have been impacted by the current crisis recover going forward. So I'd like to thank you for that. That's all I have to say on that. I think we'll take a few questions and answers now. Now, just to give credit where it's due, my co-author, my co-lead author, Lucy Martin, is the expert on administrative burdens, benefits, supports, and that. So any questions on that, I'll direct to her.
Thanks so much, Dermot. really good job. We might not let you off so lightly on questions though. But anyway, people have submitted some questions through the Q&A function already, so I'm just going to relay them to Dermot and Lucy. We'll take a few, then we'll bring in our other contributors, and then we might go back to some Q&A towards the end of that. But just to begin, it's Neil Dalziel has asked the question. I'll just read it out, and then Dermot and Lucy, you can decide who wants to take it. So if the report could have gone into physical and mental health implications, what would they be seeing for the families and children who responded? So again, I know something like that may not have been covered directly in the report, but do either of you want to comment?
Yeah, I can take that one. Yeah. Okay. So yeah, as Alan said, we didn't explicitly, and as you acknowledge yourself in your question, we didn't explicitly measure that in the survey. Now, what we do see is that a lot of households made cuts to health spending. So that runs the risk of causing future health problems, both physical and mentally. We do also see that households found responses very stressful, particularly with those in deprivation and where they had to make risky responses, and that those risky responses were linked to poor mental health. So, it's possible that there's long-term impacts there on mental health going forward. In general, the general point that households who made risky responses or had to undertake risky responses during the crisis, whatever they may be, if that threatens their financial security going forward, well, then of course, all of these things are linked in terms of mental and physical health. We know that financial hardship from other research is linked to poor physical and poor mental health. So but we can't draw any hard and fast conclusions or implications from the limited data we have, but they're possibilities.
Great, thanks for that. Next question is probably one for you, Lucy, and it's a really interesting one, I have to say, an anonymous attendee, but a great question. So in a redesign process for the administrative application for benefits, would user participation be beneficial to redesigning the process? Really good question. You got it on mute, Lucy.
Thank you. Okay, so yeah, that's a really interesting question. And of course, our evidence itself doesn't tell us, the solution. It's more highlighting what the problem is. But there is kind of a relatively young and fast growing literature on administrative burdens and what we can do to reduce them and make benefits easier to access, right? And user participation is a massive part of that literature. Partly because when we try to redesign a benefits access procedure, often the people redesigning it are extremely familiar with the system. So it can be very hard to actually see what is tripping people up, what's discouraging them from completing an application process or from finding out if they're eligible. And we call this the empathy gap between, somebody who's pretty much an expert in a benefit and then somebody who's never heard of it, doesn't even know what they might be eligible for. So yes, user experience, piloting, even things like mystery shopping are methods that have been incorporated into trying to carry out these behavioral audits of benefits procedures, just to try and see from a user's point of view what it's like. And in fact, just to show as a quick example to wrap up the value of user experience, this morning after going on the radio to chat about, to share our findings with the public, I had a member of the public who called me and said, you should really think about the role of digital exclusion because I work with a lot of older people and, putting everything online with your fancy single point of application isn't going to help those people who are digitally excluded. And that's something that, we do note in our report, but those are, kind of the insights we can get by making sure that we incorporate users' direct experience and feedback when redesigning processes to reduce administrative burden.
Yeah, no, interesting. One of the reasons the question really struck me as interesting is increasingly in research, and over my 30 years in research, you hear the phrase participatory research much more, and the notion of involving people in the research that you're actually researching. And it's an interesting question from public administration if there's a parallel issue. So anyway, thanks for the question. Now, Question from Colette Bennett, and it's one of those cause and effect type questions. So again, read through it. So on risky responses and mental health. So you sort of saw that relationship. So did the question, or did you ask if mental health was a concern before undertaking risky responses or after? And I guess again, what Colette is driving at here is, are people with poor mental health more likely to engage in risky responses, or might the risky response contribute to the poor mental health? So the standard cause and effect question from Colette. So
yeah,
Lucy, Dermot,
I can take that one. Yeah. So our analysis of the link between mental health and risky responses, we can't claim causality there, right? We can see that there's an association, right? And what we did do, we asked people what to rate their mental health currently and to rate their mental health in the beginning of 2022 before the crisis kicked off, right? So when we were analyzing the relationship between current mental health and risky responses, we did control for mental health at the beginning of 2022. So that helps somewhat. We can't claim causality in terms of, we can't say for certain that these risky responses are causing mental health issues, but there's a suggestion there at least.
Great, thanks for that. Another anonymous attendee, their question is, did you ask about family resource centres or services like that? Basically services embedded in local communities. So the question goes on to add, those services reported an uptake in people looking for support with food, hygiene items and bills, etc. over the past few years. So family resource centres, Lucy, is that one you've?
Yeah, that's really interesting to learn. And yeah, we did have one broad category in the support services that we surveyed people about that was called church or community group. And that was kind of trying to encompass a lot of local, less formal networks rather than try to identify anything by name that might exclude a lot of them. And people did use those community and church groups quite a lot. Yeah, we didn't really ask any specific questions about what people were getting specifically in terms of services from those organizations. So it could have been interesting to ask follow-up questions on that.
Okay, question from Tyke Healy, quite a succinct question. Tyke is wondering if we could comment on why only 7% of those likely to be eligible for child benefit took it up. I missed that figure actually, but is that true? 70% only took up child benefit?
I should probably clarify something here just to make sure that everybody is really clear on what our results on the utilization of benefits mean. So in the case of child benefit, for example, it could well be the case that you have someone who did indicate that they have a child at home, but maybe they shared custody. The other parent is the one getting the child benefit and they don't live together. So that could be one of the reasons why somebody would say, yes, I have a child at home, but no, I'm not getting child benefits. Of course, there's always some kind of measurement errors with people not knowing what the benefit is called and so on, although that's less likely. And we also made sure only to survey people who said they had some role in financial decision-making and in claiming benefits in their household to make sure we kind of reduced that risk. But in general, I just want to make it really clear that our goal was to see if we look at the low-income population in Ireland, what kind of benefits are they using and around what proportions. But we don't have enough detail to say exactly that specific participant should be eligible for this, and this benefit, simply because eligibility criteria can be too complex for us to really ask that much socioeconomic information from people. But it's still a useful exercise when we see the vast discrepancies between what we would expect overall and then what people actually tell us they're using.
Great, thanks for that. Kind of a methods question next, and again, it may be tricky for you to answer, but the person is asking, what other measures do you think exist that show material deprivation that can be used now to demonstrate the data? I'm not sure I fully understand the question, but I guess the idea is what's being used to measure material. Like, did you ask just if you're material deprived, or do you go through that list of CSO indicators or whatever like that? You know, there's the list of items, and if you're missing more than 2 of them, you're material. Is that the approach you used?
Yeah, that's the approach we used. We asked people the 11 items, and if they satisfied deprivation for at least 2 of them, we classified them as deprived. I think maybe what the questioner might be getting at is if you wanted to implement this to target supports at deprived households, how would you measure that? Because obviously the deprivation measure that we're currently using is a self-report measure and probably isn't suitable for that kind of purpose. So there we do discuss in the report a bit what might be possible there. For example, in the UK, they're using these vulnerability registers to identify households who are particularly vulnerable when it comes to their energy supply and their communication supply. And in that case, they use things like illness, recent bereavement, age, other factors, and a host of other factors. So we speculate in the report that perhaps going forward that a combination of indicators could be used as a kind of more objective indicators could be used as a proxy for deprivation. But as I said, there's a lot of research needed there at present.
Okay, I'm going to take one more question at the moment. Then I want to bring in our other panelists. But we'll take Louise Bayliss has submitted a question, and again, let me read it out. Louise's question is: do you think lack of index linking of thresholds for medical cards, etc., is a barrier to low-income households? And Louise just goes on: the thresholds have not been increased in over 15 years. So many people would now be out of the safety net due to increases in minimum wage and social welfare rates. So is there, I don't know if this came up in the research, if this is sort of something you're familiar with, but not non-indexation of thresholds.
So in terms of what our study can tell us about this, that's not something we studied. And if anything, other colleagues at the ESRI who have done detailed work on the take-up rates of medical card with better modeling methods that are actually trying to hone in on that specific research question, that's kind of a better fit for that. So that might be a better place to look at if you're interested. But I still want to say, even if we accept that that is the case and that many people are now being kind of like pushed out of the threshold due to inflation and so on, we still found, looking at the equivalized income of the households in our sample, that the vast majority should be eligible currently for medical cards or GP visit cards, and still that doesn't explain to us the discrepancy.
Yeah, no, I'd say one of the biggest sort of surprises in my career at the ESRI was watching colleagues doing work on the non-take-up of payments, and the two that stood out were medical cards and also the it used to be the family income supplement, but I forget exactly the name of that current supplement. But again, take-up rates were remarkably lower than one would expect. Look, as I said, I'm eager to bring some other colleagues. We've got three people from different interesting backgrounds who are going to contribute to the discussion. So we've got Nat O'Connor, Assistant Prof of Social Policy in UCD, Izzy Petrie from the St. Vincent de Paul, and Anna Visser from the Department of the Taoiseach. So we've got an academic, an NGO person, and a civil servant. So it's a great lineup. So I'm wondering, Nat, would you mind maybe kicking off? And we gave you a little bit of homework, and the homework was just to sort of reflect broadly on the report and sort of share your main takeaways with us. So looking forward to hearing from you, Nat.
Thanks very much indeed. And first to say congratulations on the report. I think it's very timely and really very useful to get this analysis. So the first thing I say is I was doing a bit of work with Age Action on the income situation of older persons through surveys and focus groups. And one of the findings that from that report, but also from other research with older people, is the administrative burden is something that comes up again and again. It could be digital exclusion, because 3 in 10 older persons are not using the internet at all, and another 3 in 10 would have below basic digital skills. But also any situation where there's a need for an appeal, for example, for a welfare claim or to trying to get access to a service, older people report repeatedly the frustration and feeling sort of browbeaten and beaten down that they just can't get through to resolve their concern. So that, I think, sort of triangulates very strongly with, half the recommendations of the report, some sort of 5, 6, 7, 8, about administrative burdens, about the kind of behavioural audits, about the difficulties that people face of getting access to services. So I think that really rings very true. And I think that's a really important aspect of the report, is the question of behavioural audits or sometimes called sludge audits, that people are sort of trekked through the morass of paperwork or other issues in order to get access to services. And I think for me, that's a real takeaway finding in terms of the report. In terms of how we could move forward, one of the issues that came up during the period of inflation is, of course, the income adequacy attached to social protection payments, and the fact that our social protection payments are at the will of the government of the day. It's up to the minister to not only propose but successfully convince government colleagues to increase welfare on a year-by-year basis, whereas most jurisdictions have some system of indexation where there would be a benchmark set, such as a percentage of average wages or in alignment with the consumer price index, and that welfare payments would go up year on year in line with those indexes. We don't have indexation, so as a result, what we saw was a lag effect, that the inflation kicked in, people were losing spending power. There was no initial response from welfare. Then it was a fiver, then it was €12, and so there was a delayed reaction by the social protection system. And of course, the budget only happens once a year, and as a result of that, people lost spending power for a prolonged period before those welfare increases came in. And even when they did come in, allied with the one-off payments, I've gone spreadsheets going through the various iterations of how people can get access to different welfare payments. But even in the best case scenarios, people were not replacing all of their lost spending power, particularly couples who were getting one payment for the household, such as an extra fuel allowance payment or the energy credits. But of course, they shared it between them. And of course, each of them had lost, particularly pensioners, had lost income. And so they weren't making that income back. So something to do with indexation of welfare incomes, I think, would be very important in terms of, where we might go from here. In terms of the long-term negative effect, it's important that, in one of the first charts we saw there in the presentation, inflation rates went up and inflation rates went down. But of course, that's not what's happened to prices. Prices have gone up and they've stayed at this new level, and they're continuing to go up. But of course, they're only going up now at a 2-3% a year. But the high prices are the new normal, and everything needs to realign to get back in line with that. Many older persons who had cash savings, often modest amounts, have simply lost 10 or 20% of the spending power of those cash savings. And that's a scarring effect that's occurred due to this cost of living crisis. And of course, they're not getting that money back. And so that's going to have a knock-on effect in their ability to afford a home renovation or to replace a worn-out boiler or a second-hand car, in older age, because of course they're not in a position to build their savings back up again. So in terms of scarring effect, some of the effects are going to be quite long-term in terms of how people's spending power, particularly the spending power of savings is gone. I could say a whole lot of other things, but just one thing occurred to me just to contribute to the discussion is that the sample of people who took part in the survey were on low incomes based on equivalized income, whereas welfare payments thresholds of eligibility and means tests are based on income, not equivalized. And I wonder whether there's a misalignment there, that when we equivalize income, we realize that people might actually have quite a low income in real terms in spending power. But of course, the welfare system doesn't take account of that in many cases. It might give you some allowance for having dependents, but often those income thresholds for means testing, just don't align with equivalized income. So there might be something there that we need to tease out.
Great, thanks for that, Nat. Obviously, you'll be staying with us, and feel free. Let me firstly say that people who are entering comments into the Q&A function, you can respond to any of the panelists as well as responding to the report, and we'll keep the conversation going. And I'm sure we'll be back to you in a couple of seconds, or a couple of minutes at least, Nat. So, Izzy Petrie from the Vincent Paul. Izzy, would you like to take the screen now and again just offer your reflections on the report?
Yeah, sure. Thank you, Alan, and thanks to the authors for sharing the report today, publishing the report and sharing the findings with us. So I think from my perspective, from SVP's perspective, my kind of first impression of the report and the findings, how strongly they do align and kind of echo our experience over recent years at SVP. So first off, that kind of the initial kind of striking maybe headline figure of how many low-income households were cutting back on those absolute basics, you know, starting with the food and the groceries, but also electricity and heating. That's very much echoes what we've seen at SVP. And whilst the report is that snapshot in time, it's a survey at one point in time, we have definitely seen that continuing and know that was, you know, a continuing occurrence for many households we support. So also findings from the report around kind of the stress levels and associations with mental health that I know the authors were just discussing there briefly, also really ring true with our experience. The report showed the highest stress levels for falling into arrears, and that's often the point at which we hear from people with a real sense of panic, either at the kind of the build-up of maybe debt and arrears over a period of time as they've been trying to keep on top of the cost of living and inflation, or getting that kind of that one bill or one payment that's come in and people know they're just not going to be able to meet it, and there is that sense of panic there. People are often unsure what to do next, where to go to next, how to navigate the kind of next step of being in that situation. So I also think the report has a really important focus on the lasting impact from this period. And as Nat just said there, you know, maybe our attention is as slight as those inflation rates have come down. Maybe our attention has gone slightly elsewhere, but those prices haven't come down. And for many people, there are the legacy impacts of those prices still being high, but also maybe some of the actions they had to take during, you know, the height of inflation going up at really rapid rates. So kind of falling into arrears or debts that need to be paid back, and maybe still are being paid back, that kind of effectively increases your cost of living because you might be paying twice as much, you know, as you're paying your arrears alongside your ongoing costs. Cutting back on those kind of educational health costs that, you know, contribute to inequalities long term. Also, and I think the report touches on this, the potential impacts on children from having lived in households where there was heightened deprivation for a period of time and living in households where there was that stress and, you know, going without the basics. So I think kind of really highlighting the fact that the cost of living crisis hasn't gone away for a lot of people, and that this is actually needs a long-term policy response and that long-term strategy to kind of get back onto an even keel, as well as rebuild resilience for the future, is really, really important finding of the report. And then just finally, and potentially a broader point, something that really struck me, which is quite the report says quite early on, is that at the time the survey was undertaken, there weren't kind of similar studies on how the public had responded to the cost of living crisis in terms of, you know, the different strategies or responses people had done, or on the take up of supports that were out there, which I thought was quite a kind of sobering reflection on how the policy making process and how things kind of unfolded over recent years, with kind of iterative budgets, with kind of different ad hoc payments and things like that, but without this kind of very clear evidence base that this report now provides about how that translated into what people were experiencing day to day in terms of, you know, what they were having to do in their day-to-day life, cut back on groceries, fall into arrears for the first time, these stressful responses, but also the accessibility of different supports being rolled out by government, or, you know, the uptake of different services. So just something that will definitely stick with me is just the importance of this type of research as well in the policy making process, and maybe repeating this research to get a kind of update on the situation for people, but also kind of this type of research, but a deeper dive, so maybe into particular experiences around energy, I think would be really helpful, and, you know, the different ways the cost of living crisis impacted people in their energy decisions and responses there.
Great, thanks for that, Izzy. Can I just follow up one quick question with you, and it relates. I mean, Nat and yourself have both made this point that while the very high rates of inflation eased off, the price level sort of stabilized at a higher level. And I'm just wondering, in terms of Vincent de Paul's experience, have you sort of experienced that you had this situation where you had people and families who contacted and availed of your services for the first time during the cost of living crisis, but in a sense then they've remained connected to you? It's not like, you know, that this was a transitory sort of effect, that they were in touch with you in 2022 and 2023 and things have improved, but that there's almost like a new sort of client group. Has that been observed by you guys?
Well, definitely there's definitely been the observation very clearly that people would have been getting in touch and reaching out for help who hadn't before and were perhaps unfamiliar and, had just been, hadn't had to use our services before and then, got to a stage where they got in touch with St Vincent de Paul. So there was definitely new people getting in touch with us. A lot of people would have talked, a lot of SVP members would have talked about people being in work, getting in touch for the first time, things like that. I suppose from our numbers, maybe it would make sense that those people then might continue and have come back to SVP again, because what we have seen in terms of the overall numbers of requests that we're getting is over those periods of very rapid inflation, the cost of living crisis, we were seeing kind of very significant annual jumps of maybe 10 to 20% a year in the numbers of requests that were coming in. And actually last year, as in 2023 to 2024, was the first year where that stabilised for the first time since the cost of living crisis. So we didn't see that big jump again, but what we did see is this kind of very elevated level of need is now entrenched. We didn't see a decrease, which would have maybe matched the public narrative that the cost of living crisis was over. What we saw is just a plateauing at this extremely elevated level of need that we wouldn't have seen before. So maybe that would suggest that, people came to SVP and, would have been using other services in the report as well, and are now sort of still needing that ongoing assistance.
Okay, listen, thanks so much for that. I want to call in Anna Visser now. Anna's with the Department of the Taoiseach, specifically the Child Poverty unit, also connected to the Wellbeing unit in the department. So Anna, do you want to offer us your reflections? I hope you're still there, Anna.
I'm here, but I'm not able to undo my own video, so someone else needs to turn my video on.
No worries. We can hear you loud and clear anyway, Anna.
Okay, great.
Now we can see it.
There you go, and now you can see me as well. Yeah. Thanks very much, Alan, and thanks very much for the presentation of the research and to colleagues for their comments so far. It's really very interesting for us to read this and really very much welcome the kind of policy orientation of it, particularly in terms of some of the recommendations. I guess there was, going through it at the weekend, there were a couple of things that really landed with me thinking of it through that kind of policy lens. And obviously I'm always looking at it more through a children and family a family perspective as well, and those findings were quite stark in this research, as indeed they always are, right? Children and families, we know, are much more vulnerable to experiencing poverty than any other group in society. But one of the things that threaded through for me was the question of agency and choice. So when you experience poverty and deprivation, you have less choices than perhaps other people in society. But looking at the experience of the cost of living crisis, you can see that further erosion of choice. So if you're already going into that supermarket, having already moved away from the more expensive items to cheaper items, you're already the person who's figuring out in your head what the total is going to be by the time you get to the checkout. In a situation like this, you've got nowhere to go, right? Other people and other groups in society still have choices they can make about, maybe we know from the supermarkets there was a big shift away from branded products to own brand products, but people living on low incomes can't make those kinds of choices. And I think that the research also tells us a little bit about the impact that has in terms of well-being and mental health and agency and how people feel about their lives. So it was just very striking that, we know this already about experiences of living in poverty, but that the way that people get caught in terms of the types of choices they can make about their own lives and indeed their children's lives. And indeed, the ESRI has done a lot of work in this area before, and I know your colleagues, Alan, have worked a lot with GUI data and really tracked what the longer term consequences are of that. I think someone was asking earlier on about health and physical health consequences, but we also know in terms of, a 9-year-old who's grown up in poverty is more than twice as likely to not have good self-concept than one who hasn't, right? That's 9-year-olds who don't think well of themselves because of this experience of poverty. And that tracks the whole way through as they're growing up and into adulthood. So I think that the price that we pay as a society when children are living in these situations is really, really stark. And I was also, the other kind of major point for me from it was where our conversation has already gone today around some of the behavioural things about, well, why are we seeing these low take-ups? And I have no doubt that administrative burden and hassle and information and all of those things are factors. And the good news is we can do things about those. And it's been really useful to hear from Lucy about that already today. But I was struck recently, I was talking to a single parent who had been on a social housing waiting list for 17 years. Now, that's a phenomenal amount of time. She was not in a disaster situation by any stretch of the imagination. She was working full time. She was getting support with her rent on RAS. So, you know, things were relatively stable. So that wasn't a disaster. But then, of course, what happened was that she was given an eviction notice by her landlord. That happens a lot. We know that. And found herself in this situation of, oh, what am I going to do now? So she went back to council to explain what was going on. And they said, well, listen, we've got really good news for you. You've been on this list for such a long time that actually you're top of it, right? There's a house available in the local area. It'll be available in 2 weeks. It's, it sounded great, totally met their needs. You know, it was kind of miraculous situation, really good news story. And she described, though, you know, she had to accept the offer by midnight on a Tuesday evening. And she was sitting there at the computer with her finger hanging over the accept button, reluctant to press it. And I said, well, what's that about, right? You deserve this. You've waited a long time for it. You're in desperate need of it. And she goes, yeah, but it's not how I imagined my life playing out, right? This is not what I had thought was going to happen. And so for her, making that transition and giving up on that, I really thought I was going to buy a house one day. That was a huge step. And I think there's something very deep in terms of the relationships there. So, you know, and I think that's something we need to explore a lot more. And that the research very helpfully points that we do need to look at this area a bit more in terms of take-up. So I was thinking about her as I read the report, right? And I was thinking, I think it's, you know, there's something very complex going on here in terms of how we design our policies and services that we need to account for.
Brilliant. I come back to you in a second, Nat, but just to, I always say when I'm sharing these things that I won't take up too much airtime, and I probably end up taking a certain amount of airtime. But, you know, funny, you know, on that issue of the non-take-up of benefits, okay, and this issue almost of people being sort of concerned, if you listen to the public discourse, the biggest problem in the welfare system is the undeserved taking benefits, okay? You know, the way, like, all the news stories are basically welfare fraud and suspicions about, you know, these things being too generous or whatever like that. But if you look again at the the low take-up of some of these, what amazes me, and it's probably particularly fascinating as an economist, you know, you always expect that people are income maximizers. But two fascinating things have always come out, well, loads of fascinating things have come out of ESRI research that I've had the pleasure of reading over the year, but it's been fascinating, the low take-up of benefits. The other is where people actually choose to work even when they're entitled to benefits, and where there might even be a financial benefit to them being on benefits, that desire to work. Now, yeah, of course, there are problems in the welfare system, and of course, the undeserving on occasions do take these things up. But it's just, I think, when we chip away, and sometimes these reports, I think, are just valuable to uncover something else. Lucy and Dermot, by the way, if you want to come in on the conversation, feel free to do so. And just to say to folks online, we have more questions in the Q&A function, which I'll come back to. But Nat, you wanted to come in with a comment, and actually I want to come in with a question to you as well, but I'll allow your comment first.
Okay, just linking to what you just said and what Anna was saying there, one of the findings of working with older people about how they manage their money is that the virtue placed on frugality, that people will really just see it as a virtue, and they see it as, you know, proper behavior to be very careful with their money. And that can be a very positive thing. I mean, I was certainly brought up in an era where you manage your things very carefully, and secondhand clothes is perfectly normal. But it can have a negative side, that it can lead to a culture of older people feeling that they've paid for their state pensions and the social insurance, but they never darken the door of a social protection office because they feel it's for other people, or that, you know, I've worked all my life for 40 years. I'm not going to go looking for a fuel allowance or whatever it might be, because it's seen as looking for something charitable. And there's a lot of pride or cultural issues. I mean, really the issues you mentioned there, Alan, about people seeing the welfare can be seen as in a negative light. by some people, that they simply don't want to associate themselves with it, or they don't want to be seen in the village of standing in that queue. And I think some of those cultural barriers as well as informational barriers exist to help explain why people don't take up welfare.
Yeah. Now, the question I want to ask you is the following. I think we're all familiar with this now, that there is an increasing cohort of older people who are renters. Okay, and that a lot of Ireland's social protection system, okay, if you think about, the rate at which we pay both contributory and non-contributory pensions, they're absolutely fine if you're a homeowner with your mortgage paid off. And it's almost like they hark back to a time when that was more commonplace. But given that we have more and more older people transitioning into retirement as renters, is that emerging more and more as a factor in terms of the sort of income and standards of living for older people? I mean, I assume it's going to get worse and worse. And then when Anna sort of touched on that issue then of sort of insecurity of tenure, it sort of strikes me as an older person, apart from having a decent standard of living, it's the security of knowing is sort of something that really matters enormously, and something we should be trying to protect. So I don't know if you want to take a minute to talk about again that housing older person interaction.
Yep. That there's a huge amount in what you just said. I mean, first of all, in the census data, we've seen it was like 2-point-something% in 2016, up to 3.5% in 2022, in terms of the number of over 65s who are renting in the private rented sector. It's, really mostly people in their late 60s, some in their early 70s who are renters. If we look at the data for people in their early 60s and their 50s who are renters, there's a much larger group. So it's like a triangle. There's a wedge of people who are private renters entering into older age. And this has three major effects on three of the most expensive areas where the state spends money. The state pension is predicated on the idea that you're a homeowner. You don't need extra money to pay your rent. The acute hospital services assume that many people will have health insurance, but if you're paying the rent, you certainly won't be affording health insurance. And so you're reliant on the public healthcare system. And of course, home care, we rely for the nursing home care on the Fair Deal scheme, which takes a percentage of the value of people's homes, and people can't access Fair Deal without home ownership. So the huge amount of the state's pillars of social protection and social public services in older age are predicated on home ownership. And so that whole system is likely to grind to a halt, in a way that is, it's very rapid. We're going to see a 111% increase in the number of people aged 60 and older in 30 years, a 260% increase in the over 80s, who are major users of healthcare and so on. And into that mix of a much larger older population, a growing proportion of them are renters. So not only will it be going from 3.5% to 5%, but that 5% will represent a larger number in terms of housing units. And of course, there are so few housing units available that that's a crucial issue. So there's an awful lot packed into this, and it's going to be a major concern.
Yeah. Okay, let's take another few questions from folks online. And Lucy and Dermot, kind of hoping you're still there. You may, and again, other colleagues can come in. So next question again, anonymous attendee. Is there a tension between creating supports that are targeted to those who need them most and simplifying eligibility requirements to reduce administrative burdens? How can we best address this? So, I mean, I think this is a pretty classic trade-off, targeting versus simplification. So, Lucy, I think you were on the radio. I think you were asked about this on the radio this morning. I don't know if you want to.
I was.
You've had a few hours to reflect on it since. So, what did you? What do you think? What's the answer?
I mean, pretty much the tension between having checks and balances and making sure that supports go to people who actually need them is kind of the basic decision, I guess, that you have to make in policy making. And I'm glad I'm not the one who has to make it. But what we can contribute with our evidence is saying, okay, of course, we need some sort of criteria, we need checks and balances. But what we can see in the current system from our evidence is the people who are on the lowest incomes, the people who are living in material deprivation, they're the ones who are telling us it's the most difficult for them to be, interacting with the benefit system. So clearly that means that there is scope to simplify without compromising on, the actual criteria. There are things that we can do without actually loosening criteria, right? Using information that we already have, pre-filling forms, defaulting people. That's all done based on information that we might have that's relevant to determining eligibility, contacting households who we think might be eligible, things like that. So there is best practice and studies in behavioral science that run interventions to try and increase take-up among eligible households. And they actually found that even offering assistance can be tricky, because the people who are more likely to take up assistance, for example, somebody calls you and say, oh, I think you're eligible, I'm from the Social Security Office, I think you're eligible for food stamps, I'll help you apply if you want. So this is one of the studies that I'm referring to. The people who take up the help are the least vulnerable among that eligible sample. So it's obviously still a good thing to do, because that means people who are entitled to the help are getting it when you take these interventions. But it also means that you have to be really careful in how to best target additional efforts to really try and reach people who currently, okay, there are checks and balances and we need them, but they might be the most discouraging for people who most need help. And if I can maybe just piggyback onto that and make one more point about, the general stigma and identity and sort of deep-seated psychological aspects of both, interacting with benefit system in general and dealing with administrative burdens. I completely take your point. I think it was Anna who mentioned, I agree, it's beyond having to do a bit of paperwork. It's much deeper than that, right? But often what we've seen in other studies, not ones that we've done, but from the literature on this topic, is that people also interpret and experience the rules as telling them something about themselves. Having a lot of seemingly invasive or very demanding procedures, that's also something that a message that you're receiving about yourself and your place in the system. So I just wanted to flag that, the paperwork and the psychological impact are intertwined. And in fact, one final example of a really exciting, one of my favorite studies from last year was about reducing stigma and reducing administrative burden. And it was in the US. They just sent postcards to households in neighborhoods that were likely to struggle with housing payments and stuff. And the treatment, the intervention was to say, are you struggling with the housing payments? It's not your fault. Lots of people are struggling and we can help. And just including that extra sentence targeting stigma closed the race gap in the people who were actually applying to and successfully accessing those housing benefits. So I thought that was a really exciting way to see how, we need checks and balances, but we also need to be aware of who is being potentially excluded by these checks and balances, and then to try and reconcile potential psychological effects as well.
Yeah, very, very interesting. Anna, you wanted to come in and see your hand up?
Yeah, just that is really interesting. But just going back to the point around targeted versus universal, I mean, I think one of the really interesting questions the research raises is, how do we use measures of deprivation to do better targeted interventions, right? What can deprivation tell us in terms of how we target resources? And we like to talk about good universal and bad universal, right? There are some universal supports and services which are incredibly effective for child well-being and child poverty. And there are others, I won't dwell on them, which are less so. But in terms of that question around deprivation and the relationship between, I suppose, general measures of deprivation and child-specific measures of deprivation, and we do have the 2021 data on child-specific deprivation, and very interestingly, at the end of this month, we'll have the 2024 iteration of that from the Central Statistics Office. And we're certainly keen to have a look at that, given what we know has happened to deprivation over the last few years and given the findings of this research. But I think we have things we can already learn from, right? We already have responses which are attempting to do exactly that. So DESH interventions, or the new Equal Start model around kind of targeted measures to support kids who experience a disadvantage in earlier settings. So we can learn quite a lot from that. I think one area maybe which is important from a deprivation and a targeting perspective that we need to look a little bit more at is some of the participation type indicators. So leisure activities, can you afford your kid's birthday party? Those things that we consider very normal day to day, but are often the first to go in a cost of living crisis. And we know are the most frequent experiences of deprivation often. If you strip housing costs out, which are obviously incredibly significant. And I think maybe as a society we need to think about that space as well, because of the long-term impacts of those experiences on kids and for well-being in the long term. So I think it's a really valuable contribution of this piece of work to raise that question around deprivation and targeting, and maybe the ways in which we need to think about that a bit more.
Yeah, no, fascinating. And I should say, actually, I mean, as you were talking, Lucy, and as others were talking, I mean, it strikes me. I honestly believe the Department of Social Protection want to make the payments to people who are entitled to them. Okay, I mean, again, it's sort of some things you can see almost a conspiracy theory on occasions that the sort of eligibility is in some sense shrouded, or the admin burden is to discourage people. But I have to say that that's not where I think things are at, and I think in many ways the department, Lucy, would be very, very interested in talking about some of those ideas you have about destigmatizing. I'm not sure if that's even a word, but anyway, it's an interesting one. Okay, let's try and squeeze in another couple of questions in the time we have remaining. So next question from Ava Koromilas. So Ava is interested in the idea of doing behavioral audits systematically. Okay, so what are some surprising results you got from the service audits or the burden assessment, and is there an interest in adopting this approach more widely? So Lucy, does that?
Yeah. So that's a really interesting question, because in fact I know in Ireland and potentially in the literature in general, what we did, which was to use a few simple comparable questions for a number of different benefits and services, is quite unusual. Most research where you can learn about administrative burdens, there's a specific case study, a policy, a target group, and you go really in depth and understand all the factors that impact them. What we did was to try and observe the landscape of burdens. What's people's experience in general? How does it vary across population groups and across benefits? So that means we weren't really able to learn about specific features of individual services or benefits, but it does give us really strong hints as to where our future research and intervention design efforts might be best targeted. So it might be benefits where we were surprised to see lower participation rates. It might be services where we know from speaking to people who work there that they are maybe struggling to reach particular groups in the population, and so on. So I think we really see the administrative burden part of this research as a first step to sort of put administrative burden and the possibility of a much more systematic behavioral review of particularly processes even on the table, on the agenda, and try and see if anyone's interested for us to hopefully look at that in more depth.
Oh, very good. Izzy, did you want to come in at all?
Yeah, I was just going to jump in on that. It's just something that occurred to me as Lucy was speaking, is like, I think a fantastic thing to come out of this report would be more of those kind of in-depth audits about particular payments that may be maybe have high administrative burdens or low uptake of services or benefits. But it is also just, as Lucy was saying, a real strength of the report that it does do a kind of very broad overview, because maybe that also speaks to part of the reality of what people face when they are in a financial crisis, and there is complexity there, and they are having to navigate kind of stress in housing costs, as well as stress in energy bills, as well as maybe not being sure that they are on the right social welfare payment or on all of the social welfare payments they are. So maybe there is also that assessment there for people in looking across the administrative burdens and seeing what realistically, given I only have so much time and I'm also dealing with X, Y, and Z, where can I focus my capacity to fill out this form, however long the form is. And then also it would be really interesting if there was research into a bit more about the different factors that influence those decisions that people make. So whether that's prior experiences of a service or a particular benefit, and whether how that then influences whether they go back to take that up again, whether they there's been a rejection or it was more difficult than they thought. And also hearing like we said, the way services are talked about by the administrator of the service or benefit, but also just kind of more widely in society or amongst friends and family as well.
Great, thanks for that. So another question from Naomi Feely, and actually, well, anyway, we can see who wants to answer it, but I'll read out Naomi's question. So the research indicates the cost of living responses should be targeted towards those experiencing deprivation. Did the research consider the adequacy of social welfare rates in general, and whether permanent increases in weekly rates would mitigate future cost of living prices for those experiencing deprivation. I'm thinking in particular people have an inadequate income to begin with, if there's a deepened crisis. I mean, I think Naomi is getting at that issue that I know colleagues in the Institute have been working on over the last couple of years, that the social welfare package, if I can describe it like that, in the recent budgets has had a substantial one-off component in it. And when my colleagues have done the analysis, which they do every year, looking at the distributional implications of the budgets, the budgets of recent years have looked quite positive. But if you take out the one-off measures, all of a sudden they don't look quite as strong. Now, again, Nat, I don't know, you might want to sort of comment on this one, and Anna, this is one that you maybe couldn't possibly comment. But it has been interesting over the last number of years that the one-off payments kind of suited the government, and I think there was a bit of a sense that they were maybe worried about baking in long-run increases or permanent increase into expenditures for fear that something bad would happen. Now, we could be on the threshold of seeing that bad thing happen, so maybe this was a sensible issue. But Nat, again, I was also struck, you were talking earlier on about non-indexation. And again, this is sort of something that I've become keenly aware of over the years as ESRI director. Politicians, I think, are always against indexation because they like being able to say in the budget, we have increased the social welfare payment by €5 or €10 or whatever it is. And the reason I've seen the sensitivity about this over the years is when the ESRI did its analysis of the budget, the benchmark it always used was indexation to earnings, and then the policies were assessed relative to that benchmark. And while the minister would often talk about having increased pensions by 5 or 10%, often the ESRI would then come along and sort of say, well, actually, you didn't increase them at all because the benchmark had been different, and it was that indexation. So on indexation, one-off payments and all those sort of things, Nat, do you want to just sort of say a word or two about your impressions? And don't get overly political now, just cold
well,
facts.
I suppose the irony in all this is that we used a universal approach and gave universal energy credits. And they were one of two mechanisms, along with income tax cuts beyond the effect of inflation, that were themselves inflationary. And the central bank analysis, I think, showed 1.9 percentage points of inflation was caused by excess of government action. And that puts €1 billion or more onto the cost of public spending every year. It puts 100 million or more onto the cost of social welfare every year. Just the fact that we have inflated costs across the economy, and that's inflated public sector pay and all the rest of it. So ironically, by going for a universal benefit, we may have inflated the economy more. And of course, that's a permanent effect. So one-off benefits, obviously politically, are very popular. And we know from Daniel Kahneman and others that human beings don't like to see things taken away. And so it's been quite difficult for the political system to take away the energy credits and to take away other one-off payments, such as the fuel allowance lump sum, disability lump sum, and so on. And everybody has lobbied for those to be retained, not least the disability one as kind of a recognition of the cost of disability, which is another area of extra cost. And the ESRI has done work on that as well. So I mean, it all comes back to the concept of income adequacy. That, you know, what are we trying to achieve in the welfare system? Are we trying to get people over a line of income where they no longer experience deprivation? And ideally, it would be a line that's connected to the real economy, such as deprivation or the minimum essential standard of living, whereas the 60% median income can be arbitrary. And we know that many people above that risk of poverty line nonetheless still suffer deprivation. And that's a key finding of this report, that deprivation is really telling us something different. But, you know, if we want income adequacy, then we have to come back to indexation. Now, it can be done. I mean, and every other OECD country indexes their state pension except us. We're in this unusual situation where we're really an outlier in terms of how we manage welfare. And in times of crisis, what we see is structurally people at the bottom end of society or middle to bottom end simply go down a step or go down a couple of steps and don't recover, or it may take years until they recover their situation. And that has all sorts of negative social consequences. Now, we can
actually, Nat, I see we've hit 3:30 and Anna has her hand up. So with your permission, can I bring in Anna?
You can, of course.
And then we might need to wrap then at that stage.
I will be very brief. Just on this point of the one-offs, one of the very interesting and perhaps unintended consequences, and I don't have the figures in front of me, but we know this from DSP colleagues, is that it actually drove take-up. So because people were aware of that they might be entitled to a one-off benefit or payment, it drove take-up more generally, and that was true with the working family payment in particular. So anyway, the way these things interact are often very interesting.
Yeah, no, good point, and an interesting point, Anna, and thanks for that. Look, we always try to finish on time, so we're going to do that. Apologies, there's a number of additional questions that we haven't been able to get to, but people should feel free maybe to email Lucy and Dermot with those, and I know they'll be happy to answer them. So I want to again thank Issy, Anna, and Nat for coming along, and earlier on, Mark. Thank everybody for joining the conversation. Got to thank JP Morgan Chase for funding the work, which really has sort of prompted a lot of interesting discussion over the day. So I think it's a really valuable piece of work. I won't list Lucy and Dermot's colleagues who co-authored, because I'll forget a name, and that would be bad. But just to congratulate all the authors. And yeah, anyway, just thank everybody for coming along today. I'm sure we'll be gathered either in person or on screen soon, discussing similar themes before too long. But again, thanks everybody. Go on out now, enjoy the good weather. All right, see ya.